hardship from the pandemic and fears about what's to come. Today, we're looking ahead and we'll hear from Dr. Ross Goldberg, President of the Arizona Medical Association and Vice Chair of Surgery and Specialty Ambulatory Medical Director at Valleywise Health in Phoenix, and how we can combat COVID together and the latest about the vaccine distribution in Arizona. We will also have Access Director Jami Snyder, and she will share breaking news about what Access is doing for their members to get a vaccine. If you've participated in one of our Teletown Halls, you know this is similar to a radio talk show, and you have the opportunity to ask questions live. For those of you joining us on the phone, if you would like to ask a question about the coronavirus pandemic, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask questions that are live. If you're listening through our Facebook live stream, please leave your questions and in the comment section. If you have just joined the call, I'm Dana Kennedy from AARP Arizona, and this is a live telephone town hall about the latest developments with the coronavirus and news about the vaccine distribution plans in Arizona. We're talking with Dr. Ross Goldberg, President of the Arizona Medical Association. As I stated earlier, this is an interactive call, so if you'd like to ask a question at any time during our call, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue. The sooner you press *3, the sooner you'll be online with our guest. If you're listening through Facebook live stream, please leave your questions in the comment section. As we proceed, remember, if you'd like to ask a question, press *3 on your telephone keypad to be connected with the AARP staff member who will note your name and question. The sooner you press *3, the sooner you'll be online with our guest. And we have a polling question. Have you had issues getting an appointment for COVID-19 vaccine? Press 1 for yes, and 2 for no, and 3 if not sure. Again, we have a polling question for you. If you have had problems getting a COVID-19 vaccine, press 1 for yes, 2 for no, and 3 for not sure. And I am now going to introduce our first guest, Dr. Ross Goldberg, President of the Arizona Medical Association. Ross Goldberg, MD, FACS, is the District Medical Group Vice Chair of Surgery and Specialty Ambulatory Medical Director at Valleywise Health in Phoenix. He's an Associate Professor of Surgery at both Creighton University School of Medicine and the University of Arizona College of Medicine, Phoenix. He has been active in surgery advocacy and health policy at the local, state, and federal level for over 21 years, holding the multiple positions in numerous organizations. Currently, he is the president of the Arizona Medical Association, the largest independent physician organization in the state of Arizona. Thank you, Dr. Goldberg. The floor is yours.
Well, thank you so much for having me, and good morning, everyone. It's a pleasure to be back. I'm not going to spend a lot of time talking to let you guys ask your questions. Last time I talked about the Moderna and the Pfizer vaccine, kind of the mechanism behind the messenger RNA vaccine, but I want to talk about the upcoming, hopefully soon, Johnson & Johnson vaccine that is on its way to hopefully getting into people's arms. Other type of virus that they alter, it doesn't transmit anything, but that's the vector they use to deliver that RNA so you can build up the antibodies, and that's how they're doing it. It's a single shot so far. It can be stored in a fridge, which is great, so good for distribution. What I wanted to bring up is you're hearing in the media a lot about how effective it is, and the numbers can be a bit deceiving. Let me put it in perspective before I get in the numbers. Remember, the Johnson & Johnson vaccine phase of the trial occurred at a different point during the pandemic than the Moderna and Pfizer. It happened later in the pandemic when we started to identify these variants that we're talking about, and just they also look at different areas of the world which gave different numbers and different results. So you put the average together, they're quoting about a 66% protective chance against all types of disease issues when coming to COVID. That number changes, though, as you talk about the severity of the disease. It's actually 85% effective against preventing severe disease. And really the most important part, it's 100% effective so far in stopping hospitalizations and stopping death. That's the most important number I want you to remember, is that the idea behind these vaccines isn't to completely stop the virus per se, it's to stop the really serious disease where you need to go to the hospital and that can actually kill you. And so far, like just the other two vaccines, this is very effective at doing that. So this is all very encouraging news. I've encouraged people, if you can get access to this vaccine once it's available, you should go ahead and take it. It will help. Yes, Johnson & Johnson is exploring a second dose, but we're not going to know about that for a while. And it's really been encouraging, all of the news we're getting regarding the vaccines, how people are responding to it, and that there's a lot of good data coming out. So the hope is, as we continue further, more and more people will get the vaccines, and hopefully we can get back to some sense of normalcy. That's all I have for now. I'm happy to answer any questions.
Thank you, Dr. Goldberg. And I would now like to introduce Jami Snyder. Jami serves as the Director of Access, overseeing Arizona's Medicaid and CHIP program, including the provisions of acute behavioral health and long-term care services, and supports to more than 1.8 million Arizona residents at an annual cost of $14 billion. She was appointed by Governor Doug Ducey on January 5th, 2019, after having served as the agency's deputy director since December 2017. With more than 20 years of public and private sector experience in the health and human services industry, Ms. Snyder's area of expertise include regulatory oversight, policy making, and leadership development prior to joining Access. Thank you, Director Snyder, for joining us. The floor is now yours.
Dana, thanks so much for having me today. I'm thrilled to participate in today's town hall. Just to level set a little bit before I launch into kind of what we're doing around getting the vaccine out to our membership, I should have updated my bio in anticipation of this session. We now serve 2.1 million enrollees. Our enrollment has actually grown by 290,000 individuals over the course of the pandemic since last March. And part of that is due to the fact, as some of you may know, we're receiving some additional federal funding to support our program. But one of the requirements of receiving that additional federal funding is that we not disenroll anyone over the course of the public health emergency. So a large portion of that enrollment growth that we've seen in the last 12 months has really been due to individuals remaining on the program, which we feel is a real benefit to the program. Our commitment at the onset of the pandemic at Access, Arizona's Medicaid program, was to do everything that we can to ensure ongoing access to care for our membership and to ensure the viability of our provider network so that they can offer care to those served by the program. And so maintaining individuals on the rolls over the course of the public health emergency has certainly allowed us to do that. We now serve 30% of the state's population. So what are we doing in regard to the vaccine and vaccine distribution? We have a couple of different strategies that we're pursuing. One, we know that it's fairly difficult to actually make an appointment. Just the various avenues for scheduling an appointment can be challenging and complex. I know I supported my mom in making an appointment, and it took us a while to figure out exactly where to go and how to get that appointment scheduled. So we are working with the state's 211 system to stand up an expanded call center where 211 representatives, call center representatives, will actually be able to support individuals hands-on in making their vaccination appointments. In addition, for Medicaid enrollees who have access, and all Medicaid enrollees do, who have access to non-emergency medical transportation to get to those vaccination appointments, the expanded 211 call center will be able to warm transfer to the individual's health plan to schedule that non-emergency medical transportation so they can actually get to the appointment. That's our first strategy. We plan to stand up that expanded call center in mid-March. In addition, clearly in Arizona, one of the most prominent mechanisms for getting the vaccine out to individuals are drive-through or mass vaccination sites. Well, we're fully supportive of that approach, but it does pose a challenge for the framework of our program, and specifically the provision of non-emergency medical transportation, which typically is used to drop an individual off at an appointment and then pick them up once the appointment has concluded. So we came up with a strategy because mass vaccination sites are so prominent and one of the primary approaches to getting folks in Arizona vaccinated. We decided to offer an enhanced rate of reimbursement to non-emergency medical transportation providers so they can stay with the member through the mass vaccination site in the car. So we're offering an additional almost $9 in funding to those drivers for every 30-minute increment that they're on site at that mass vaccination or drive-through vaccination site with the member. And we're also working on a strategy in partnership with AHCCCS to vaccinate drivers when they're there with members. And so more to come on that front, but we're very hopeful that this incentive that we're offering to drivers will support getting more members out to those drive-through vaccination sites, in addition to the various avenues that we're looking at through pharmacies, federally qualified health centers, where our non-emergency medical transportation can be offered in the traditional manner. In addition to that, we've been working really closely with our contracted health plans to get the vaccine out to individuals beyond nursing facilities, individuals that are living in smaller residential placements, whether it's group homes, assisted living facilities, assisted living centers, and so forth, behavioral health residential facilities, because we know that we have a tremendous responsibility when it comes to serving individuals enrolled in our long-term care program. So 63,000 individuals in our program are eligible for long-term care supports and services, and that includes services in those residential placement settings. So we've asked our health plans to partner with county health departments in developing strategies for mobile vaccinators to go out to residential settings and vaccinate members within their setting or within their living arrangement. And I'm happy to report that we have successfully launched efforts around that mobile vaccination approach in Pima County, in Maricopa County, and now in Cochise County, and plan to roll that strategy out statewide in the coming weeks as well.
Thank you so much, Director Snyder. I just really commend you and your staff for all that you're doing to make sure that we reach the most vulnerable population. I know we've had many discussions, and I've talked with your staff regarding making sure that this happens. And it's my understanding that we're the first in the country to do something such as this.
We are. We're the first state in the country to offer an enhanced rate specifically for non-emergency medical transportation through those drive-through sites. We actually are participating in a call tomorrow with the National Association of Medicaid Directors to educate our peers around the country around our approach, because we feel like it's really the most effective mechanism for ensuring our broader population is vaccinated.
Well, thank you so much. Really appreciate that update, Dr. Goldberg and Director Snyder. So if you just joined the call, I'm Dana Kennedy from AARP Arizona, and this is a live Teletown Hall to talk about the latest developments with the coronavirus news about the vaccine distribution plans in Arizona. We're talking with Dr. Ross Goldberg, President of the Arizona Medical Association, and Jami Snyder, Director of Access. As I stated earlier, this is an interactive call, so if you would like to ask a question at any time during the call, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue. The sooner you press *3, the sooner you'll be online with our guests. And if you're listening through Facebook live stream, please leave your question in the comment section. And earlier I asked a poll, and I'm going to give you one more opportunity to answer that poll question, as I know some people joined the call late because we're calling you to join. The polling question is, have you had issues getting an appointment for a COVID-19 vaccine? Press 1 for yes, 2 for no, and 3 for not sure. Again, the polling question is, have you had issues getting an appointment for a vaccine? Press 1 for yes, 2 for no, and 3 for not sure. I will now turn it over to Alex Juarez, our Arizona AARP Communications Director, for participant questions. Alex, the floor is now yours.
Thank you, Dana. Thank you, Dr. Goldberg, and thank you, Director Snyder, for being part of this Teletown Hall with such great information that we have to provide our members. Dana, I'm happy to report we have a ton of questions on the queue, so we're going to try to reach as many as possible, so please be patient with us. We will try to answer the questions as fast as possible here. I'm going to give you the results of the poll, Dana, and so far we have 53% that said yes to having issues with the getting the appointment for COVID-19 vaccine. 35% said no issues, and 12% said not sure. Thank you so much for participating on that. And with that, we're going to go straight into our questions. So first question, we are going to go to Sun City West. In Sun City West, we have Flavia.
Yes,
Flavia,
I'm here.
Can you hear us?
Yes, I'm here.
Go ahead, please.
Yes, my question was, do you think they will come out with a booster shot every year because of the various strains like they have now for the flu shots?
That's a great question.
Dr. Goldberg?
We were just talking about that beforehand. I don't know. Possibly. That's where a lot of the research is looking at right now. That's why Johnson & Johnson's looking to do, they want to do a second shot. I know that Pfizer's looking into do we need to make a third booster shot. We're not sure yet. They're going to continue to study this. I will not be surprised personally. This is my personal opinion, not any official position, that I wouldn't be surprised if something like a booster shot comes out, given the variants and what we're going through. Which honestly, in the grand scheme of things, I don't think will be that bad. But it is an interesting question. As we're learning about this coronavirus and how it evolves, we may or may not need it. We're not sure yet. That is definitely a possibility. So I would keep an eye out, because if they do say we need one, I would highly recommend continuing to follow those booster shots if they're needed.
Thank you for your question. This time we are going to go to Tempe, and in Tempe we have Marvin. Marvin, please go ahead with your question.
My question was regarding what is required when you sign up for an appointment. What information is required? I do not like to give my Social Security or my Medicare numbers out. Now, I called my health insurance. They said it was okay to show my membership card in my health insurance. And also, how are they getting people? There's so many old people that do not drive and they're not on the internet. And almost every number you call, I've called 6 different numbers, and they always refer to a website. What is being done to make it more accessible for people that are not on the internet? That's my question.
Alex, I'm happy to answer that question. So when you sign up, first of all, you want to create an account if you've not done that. So you want to go to the Arizona Department of Health Services and create an account. Once you create your account, you're going to get an email that you need to verify, and it will give you a 2-email verification. So once you've done that, then you will be able to start looking and scheduling an appointment. And you may have already done this, but I want to make sure everybody understands exactly what they need to do. So then you're able to then search for an appointment. And once you are able to get an appointment, it's going to ask you a series of questions. It's going to ask you your first name, your last name. It will ask you your address, your city, your state, your zip code. You will then need to provide your date of birth, and then it will ask you about your health insurance as well. And remember, this is free, so if you don't have your health insurance, you do not have to provide a health insurance information. But if you do have it, such as Medicare, you'll just need to provide your Medicare number. Then it's going to walk you through a series of questions to see if you qualify and when you qualify. And then you will be able to select an appointment. So those are the basic questions. You will not be asked for your Social Security number. So you'll need your address, your date of birth, and health insurance if you have it. If you don't, you just select no, and then the series of questions. And the other thing you could do is go through the county departments of health. You can also reach out to your pharmacist, so Walgreens, CVS. There's a partnership with the federal government. They're receiving vaccines all the time. So some people who have had problems getting an appointment are able to go to their local pharmacist. So you can reach out and call your pharmacist. Some people are also able to get it through smaller health providers and these health centers. And you can also, if you need problems with transportation, I know in Tempe is the Tempe Community Center. There's also a partnership with YMCA. So you can also contact YMCA. And those are different ways that you can also get transportation. And there are other organizations that are just locally formed that are helping people get transportation. So does that help answer your question? Your questions, actually?
Like Marvin's on listen mode only, I know.
Okay. Well, hopefully we're able to answer Marvin's questions. And again, as Director Snyder mentioned, you can also call 211. So if you're having problems getting an appointment, call 211. They're getting more navigators all the time to help people assist. And they also have all the community resources available. So 211 is also a great way to be able to get an appointment and also to help find if there's local transportation. And I don't know if any of the other guests have anything else to add, but we want to make sure that we're getting people information and get the help they need.
I would just follow up with that. Also, you see the 844 number if you're seeing this scroll across the screen. There are live people there that was designed to call. I actually talked with ADHS this week about it, and they wanted me to make sure, since I told them I was coming on, to let people know that you may not get on with a real person right away, but to keep calling back. There's a lot of calls coming in, obviously. So they do have some things set up for those that can't access the internet. You don't have to only do it that way. The phone still works, I promise. But as you heard, calling your pharmacy or calling these numbers, you should be able to. They are aware that people are trying to get a hold of them, and they encourage people to keep calling.
And I think it's really important. When this first rolled out, there were a lot of problems with the website. They have updated the website and fixed a lot of the problems that they were having and that people were experiencing. And then also they are adding more people to answer the 800 number as well as 211. So it's really important that if you have problems, don't give up. More vaccines are coming all the time, and more people are able to secure appointments. It's not as bad as when we first rolled it out, and it will keep getting better, especially with this new Johnson & Johnson vaccine coming out.
Great details. Thank you, Marvin, for the question. And this time we're going to go to my hometown in Anthem, Arizona, and we have Barbara. Barbara, can you hear us?
Yes, thank you.
Go right ahead.
Okay, after having had both Pfizer vaccinations, would the serum test that reveals if someone had had an undiagnosed COVID-19 infection, perhaps many months earlier, still be valid, or would that vaccination wipe out any information that would say whether they had had an untested COVID infection previously?
Great question. And it gets at, I'm going to try not to get too technical because I don't want to confuse myself. So when we are testing for COVID, so example, you go get the swab, right? That swab in the nose, that's a PCR test. That's looking for, it's looking for active virus. If you're looking for, if you've actually been exposed to it, the antibody test, if you've gotten the vaccine, you should still have antibodies. Now, you won't know if the antibodies are from the COVID, if you've been exposed, or from the vaccine, but if you have those IgG antibodies, so for example, I've gotten both doses, I went and got an antibody test, and I was positive. I knew I was negative before I'd been tested for COVID beforehand, so that IgG test, an antibody test, says I do have antibodies now to COVID. The test you're talking about, those PCR tests, looking at a different mechanism, not IgG antibodies. So if you have a COVID PCR test that's positive, that means you have the virus, active virus, that could spread or that you've been exposed to it. The antibody test means you have been exposed to something, either if you've been exposed to COVID or gotten the vaccine and have built up an immunity to COVID. So it actually is looking at different things. So if you have a positive antibody test, I would rest assured that you have immunity or some level of immunity to the virus. So if you have a positive antibody test, like an IgG test, that's what you're looking for. That's the serum test. That's the one I got. I will admit I cheated, like I got it a little too quickly after the second dose, but I was still positive, so I had some ease of mind. But it's the antibody test that will tell you if you're protected. If you're worried about being exposed to, which you can still do with even having the vaccine, you would get that PCR test, which is looking at a little different part of the virus. That's a different mechanism. That's telling you that you have active virus that's potentially transmissible versus protection with the antibodies. Hope that wasn't too bad an answer.
Thank you, Barbara, for the question. We're going to move down south, and we're going to go to Tucson. Tucson, we have Nick. Nick, can you hear us?
Yes, I can.
Go ahead, please.
Yes, my wife is 62 years old, and she has one pre-existing condition. I was wondering, I'm sorry, she's 64. Excuse me. I was wondering when she could anticipate getting the vaccination.
That is the question. So it's funny. I was talking to someone about this last week. They asked me to define what do you mean by a pre-existing condition. That's a very, very broad term, right? If you go onto the CDC's website, they break down pre-existing conditions. If you may have a risk or you do have a risk, they even take things like diabetes, type 1 or type 2, and separate it out. So my answer is I'm not sure, which is not the answer I'm sure you're looking for. But the question's becoming, and we're waiting to hear from the CDC, is how they're going to classify what is a more severe pre-existing condition versus a less severe, if that makes sense. You know, are immune compromised patients at a higher risk, so they should be put in front, versus someone that has a chronic illness that is less at risk for having problems? We don't know yet. And I know 64 is like right on the cusp. It's a little frustrating that like you're just there, and just 65 and older is the cutoff right now. I will also say there's been a lot of discussion is, do we put age ranges in to help mitigate with these pre-existing conditions? Because a lot of people have pre-existing conditions, if you think about it, if you expand the list enough. So the answer is hopefully soon. What I'm encouraged by is that the federal government's been very aggressive about getting and buying more shots to be available, so that this won't really become a problem if you have more doses than people. So the fact is that we're talking about a couple 100 million doses coming, hopefully in the next couple of months, and by no later than July, having 400 million plus doses, it shouldn't matter by that point. So my hope is we're talking about in the next couple of months, we're getting a lot of shots into people's arms, because we know there's a lot of people with pre-existing conditions who need them.
Thank you, Nick, for your question. I know
you did the right answer, but
that's right. We are going to go to Mesa this time, and we have Kenneth. Kenneth, can you hear us? Kenneth, can you hear us? We can't hear Ken, so we are going to move to Phoenix. And Phoenix, we have Arlene. Arlene,
Yes.
Can you hear us?
Yes, I can. My question is, my husband is wheelchair bound and cannot get into a car, and he is not on Medicaid, but we want to know how to get him to an appointment, or is there a mobile unit?
Yeah, need an answer, or who wants? I can make some. I can tell you from the Arizona Medical Association standpoint, we've been talking with Access and ADHS about that problem, because he's not alone. There's a lot of people that can't get to where the shots are, right? We talk about these megapods, or even the pharmacy. That may be a bit of a trip, especially talk about some of these rural areas. So we are actively working on trying to figure out ways to get shots into people's arms where you don't have to go very far. I don't have any specifics. I don't know if our director can give you more information, because you mentioned the mobile stuff too. There is stuff I know being worked on.
Yep.
No one's forgotten by it. It's just the logistics are getting pretty tricky, which we're trying to figure out.
Yeah, exactly, Dr. Goldberg. I think clearly, our reach is as far as the Medicaid population, but we recognize that there are individuals that have different types of coverage that need the same sort of support in order to get vaccinated. So for instance, our mobile units that we're using now to go out to residential facilities, we're vaccinating anyone in that residential facility, not just individuals who are Medicaid eligible. And as we look, as Dr. Goldberg said, we're working actively to problem solve for the broader population as we look to individuals that live in their own homes that may have mobility challenges. We will be expanding our solutions to the broader population as well. And in Arizona, 85% of our population that receives long-term care services, again, lives in their own home or in the community. So we naturally are are compelled to develop solutions that can serve individuals that aren't necessarily nursing facilities, but receive in-home care or in-home services and need some support to get the vaccine. So more to come, but we continue to kind of problem solve through getting it out to individuals' homes.
And just to come off what Director Snyder is talking about, I was also going to say that to tie what I said earlier, as the amount of vaccines increase, that increases the availability to get it to other bodies, to get it to people. Like, we pushed hard for physician offices. If you've got a primary care physician, how can we facilitate that? So there are pilot projects we're looking into. As there are more vaccine available, it can be widely distributed. There may be other avenues from there as well. I'm sorry for jumping in. I just wanted to throw that out there.
Well, and I was just going to mention something that Dana mentioned earlier as well. A number of community-based organizations are offering transport, including wheelchair accessible transports, like area agencies on aging. So certainly I encourage you to explore some of those other options that may be available.
And I was just going to say, we have been having conversations with all of the different community partners and area agencies on aging, the governor's office, to be able to address this issue. And I think having the Johnson & Johnson vaccine will be able to actually explore options, because before we just didn't have a vaccine that would be able to potentially work with maybe home health agencies that often go into the home. So there's a lot of conversations. We've not forgot you at all. We've just needed a vaccine that had a little bit more flexibility, and I think it's now coming.
That's great. Thank you, Arlene, for the question. And talking about Johnson & Johnson, we are going to move to Casa Grande. We have Lyle. Lyle, you're in Casa Grande. Can you hear us?
Yes.
Go ahead, please. Lyle, are you there?
Yes.
Go ahead with your question, please.
Well, they've answered some of my questions with the other ones, but I'd like to point out that back in the 50s, when they came out with the polio vaccine, I don't know how they distributed it in Arizona, but I lived in New York City, and they just used the schools. They just lined up the school kids, gave them all their vaccines, and I think the parents were able to get it too. I was young at that time. But it's an option that they could use the school on Saturday for local people to bring their grandparents and, whatever, to the school to get vaccinated.
Yeah, great point.
Yeah, there are different areas. Yeah, absolutely. As we get more vaccines, how can you expand it to get to people? So it's a great idea to use community areas where people don't have to go far and know it well. And go as a family to get it done. So these are all good ideas, and the more the merrier. And I'm just waiting for enough vaccines so we get everyone covered so we can all take a deep breath from all this.
That's right. Well, thank you. Thank you for the question. We are going to move on to Lake Havasu. And Lake Havasu, we have we have Judy. Judy, can you hear us?
Yes, I can.
Go ahead, please.
Yes. My question is, I was, after a lot of trouble, I was able to get my first shot with Embry Medical, which is actually a Phoenix-based clinic, but they opened up vaccination centers in Lake Havasu City, Kingman, and Bullhead City in Mojave County to administer vaccinations. And I was very lucky. One day, after looking, I was able to book an appointment. And so my husband and I have gotten our first shot, but now I read in the paper on Friday, and we're due for our second shot on the 2nd of March. I read on the paper on last Friday that Embry was having some problems with paperwork, and so they weren't going to be given their shots. And I do know that apparently because of this snowstorm in the central part of America, it's affected some of the delivery. And but anyway, I called Embry after reading the article in the paper that Embry wasn't going to be giving able to get vaccinations anymore. and they confirmed that yes, we don't have any vaccinations, and they weren't able to tell me what to do about getting my second shot. And I did call found out about the hotline number, and I called there, and they couldn't really give me any information on what to do. And so I'm kind of worried now. I'm supposed to get my second vaccine next Tuesday, and I don't know what to do.
Well, first, let me give you a little peace of mind that if you don't get it exactly on the day that you're supposed to, you're still going to be okay and protected. We have learned there's some wiggle room here. Not saying you want to delay a long time, but the CDC has come out and said even delaying 6 weeks in between should be okay. Some places are doing it even longer than that. We're not advocating for that. Fortunately, with the snowstorm, while it's great to live in Arizona and not have to deal with the weather like that, it affected the rest of the country. They are catching up, though, and should be caught up by this week for those deliveries that were due. You said Embry is the name of the company, if I'm not mistaken. I'm happy to pass it along to ADHS to make sure they're aware of what's going on. Again, the vaccine should hopefully be coming in. As we get more coming in, that should help with the supply. I can understand why at the time they said they couldn't, but with more coming, the hope is they can ramp back up. But I will let them know that there's an issue. I will write that down and send a message out today.
Thank you, Judy, for the question. And again, for those on the phone without internet access, the telephone number for the Arizona Department of Health information line is 844-542-8201. Again, 844-542-8201. Now we're going to move to Casa Grande. In Casa Grande, we have Diane. Diane, go ahead.
Yes, hello. I'm here.
Go ahead with your question.
Okay. I was curious as to why children were not getting the virus as adults were. And I reviewed some Google searches and found out that they don't have a type of protein in their lungs. And I'm wondering why this hasn't been broadcasted more freely, because it seems to me that if the children aren't able to acquire it like adults, why aren't these schools open?
It's a great question. So children, we're learning more and more how children respond to it. Some do still get the virus, but don't seem to get it as bad. There are some kids, unfortunately, that have gotten it. Some have passed away from it. The question also is, can the kids transmit it, though? So not so much can they get it and get symptoms, but can they be asymptomatic spreaders? And that's what we've been researching. It looks like you're right, kids, especially the younger kids, like the not high school kids, not junior high, but the younger kids have much lower chances of spreading it about, right? So the question is, why can't we open the schools? Well, there's a lot of reasons. Just because they have less chance of spreading it doesn't mean they can't do it. So you still have to have all the safety protocols in place. The CDC has come out with recommendations on how to open schools safely to make sure that you can get kids back in. But they also have to make sure is, remember, the teachers, the staff, we want them to feel safe. If you're an adult walking into a room with a bunch of kids, while the kids may be protected, you've got to protect the teachers too, though. And so the teachers want to be able to feel safe. So I understand the desire to be vaccinated and feel protected. So it's a complex issue. But I agree with you, and we've been advocating for getting the schools open if it can be done safely. We have shown, and actually studies have shown, I forget which city it was, where it was in rural, it was the Midwest, and I apologize, Wisconsin maybe, a bunch of school systems where they were able to open safely and found the rate of transmission was lower if they followed those protocols, even without the vaccines. So yes, we can open schools, but we've got to make sure they're done safely. You don't want to go back to where we were before. You need to have the physical distancing. There needs to be some modicum of mask wearing. The ventilation in the schools needs to be adequate, so you're not breathing everyone else's, CO2, things like that. So you're correct in that there are things we should do to get the schools open. In fact, I know there's a county or an area in Arizona, actually, I was seeing on the news, they have like 90% of their teachers vaccinated already. So they're actually opening at the end of March for some of their kids to get back into school. So it's a complex issue. Yes, kids are less likely to get it and get sick from it. We want to make sure that the teachers, the staff are protected as well. They're an important piece of the puzzle. Make sure that they're protected and can do okay as well.
Thank you, Diane, for the question. We're going to move on. We're going to go to Goodyear, and in Goodyear we have Robert. Robert, can you hear us?
Yes, I can. Can you hear me?
Go ahead, sir. Yes, we can hear you clearly.
All right. The question I have is, what are the roadblocks you're seeing as far as rolling out this vaccine? Is it the production, transport, the distribution, lack of providers at the administration sites?
Yes. No, I'm kidding. It is a complex logistical issue. First and foremost is vaccine supply, right? So actually producing enough vaccines for enough people. That's the first problem. The snowstorm kind of slowed things down, but now we're ramping up. And if you've been seeing the news, the Biden administration has purchased hundreds of more millions of doses to get done, but they have to make them first. Then they have to get them to the states for distribution. And then the trickiest part is getting it from the state to someone's arm, which you think sounds easy, but it's not as easy as it sounds, as we've been talking about. So there's a lot of logistical issues that go into this. We've never done something like this before. A mass nationwide vaccination attempt in a short period of time with new technology. We're literally writing the book as we do it. I will say we've improved step by step throughout the way. You heard the website was more of a troublesome problem earlier than now. We're evolving. Over 1.1 million people in Arizona have gotten at least one dose of the vaccine. Imagine where we were a couple months ago. So we really are accelerating quickly in a good way. It's just taking some time. Like with anything, we're learning what works and what doesn't, and we're kind of writing it as we go. So as we get more vaccines, as we spread it out more and more people can get it quickly, I am still very optimistic that if we stay on this path, that hopefully by midsummer, late summer, we're talking about a large majority of the population having gotten their 1 or 2 doses, depending on which vaccine they got. But it's been a challenge. I hear it all the time.
And Dr.
Thank you, Robert,
Goldberg,
for the question.
And Dr. Goldberg, just to build on that, I think I'm really excited to see the work that the administration is doing now to get the vaccine out to the community, including pharmacies and community health centers where people regularly go to get their immunizations. I think that's going to make a big difference in terms of individuals' ability to easily access the vaccine.
100% agree.
That's correct. Just as a follow-up, I think Robert had a second question about herd immunity. When can we reach that?
So it depends who you're talking to, but the range has been around 70-75% is where we're talking about most likely for herd immunity. So a fair number of people have been exposed to the virus already, so they provide some immunity there. And with the vaccinations going on, so we're talking about that 70-75%. So we've got a ways to go. Make no mistake. But we are on the right trajectory so far.
Wonderful. Thank you. We are going to move along and we're going to go to Tucson. In Tucson, we have Cecilia. Cecilia, can you hear us?
I can hear you. Can
Go
you
ahead,
hear
please.
me? Can you hear me?
Yes, we can.
Okay, excellent. My question has to do with the statistics. I'm not sure what is meant by 85% efficacy. Does it mean that only 85% of the people who get it are going to be safe? Or does it mean that only 85% of our body is going to be protected? I'm not sure what that means. That's my first question. My second question has to do with the carrier that the virus is in, the vaccine virus is in. What kind of carrier are you using? Or the various vaccines, what kind of carrier are they in? Are they still using formaldehyde or mercury and I'm not sure what this mRNA inhibitor gene therapy is, or the thimerosal. Can you explain some of those things? Can you bring some light to those questions?
Well, I will try to do my best. There's a lot of good questions in there, so let me take it one at a time. You brought up a great point, right? We've been throwing around efficacy rates with the assumption that we've all took a large class of statistics and understand what anyone is talking about. So an example of, talk about the Pfizer vaccine with its 95% efficacy rate. It doesn't say that that means 5% of the population is going to get COVID if you gave 100 people the vaccine. It talks about the ability to protect yourself of not getting COVID. So what they found looking at the studies is if I got the vaccine, the Pfizer vaccine, which I did, and I'm with someone who has not gotten the vaccine, I have 20 times the chance of not getting COVID. That's how effective the vaccine is at protecting me from getting exposed and getting the virus itself. So it's really talking about your rate of protection, not that a percentage will be protected or that every 5 people are not going to get protected. It's the ability for you to be that much more protected versus someone who doesn't have any vaccines on board. So that's what we're talking about when we come to efficacy rate, which can be a little confusing. As far as the mechanism of delivery for the virus, let's take a step back. Pfizer and Moderna are a messenger RNA vaccine. What is that? So messenger RNA, again, we make that ourselves for lots of things. Messenger RNA is the blueprint to make proteins. So all your proteins are made of these little things called amino acids. There's part of your cell called a ribosome, which think of it like it's a blueprint reader. The messenger RNA is the blueprint. It's sent to the ribosome, which reads the blueprint and constructs the protein, puts the amino acids in the right order, and then the mRNA goes away like it never existed. I call it the Mission Impossible message, right? After so many minutes, it self-destructs and goes away. So you've made this protein now. Your body recognizes this protein, which is the mRNA being used as the spike protein on the coronavirus. The spike protein is that little way for the virus to enter your cell. Your body recognizes that protein as foreign material, and you create antibodies to fight it off. So if you're exposed to it again, you fight it off. The Johnson & Johnson and the AstraZeneca vaccines are something called adenovirus. It's a technology we've used many, many times. It is using a dead virus, a manipulated adenovirus, a different type of virus, as the vector, the mechanism to get into the cell. So while the mRNA has one way of doing it, this adenovirus is bringing now the information that way. It doesn't change your cells. It's not alive. It's not going to attack you. It's something we've used a lot for a lot of different vaccines. That's how most vaccines are based, and that's how it gets into your cell. All this does, it does not alter your DNA. It does not alter what you produce. These mRNA are going outside where your DNA is housed. It is safe and it doesn't do anything like that. And so basically what you're doing is teaching your body to be the incubator to make that protein, then to make the antibody. So instead of us injecting you with a protein that you respond to, we're actually using your body as the way to produce it and then fight against it. We're finding it to be quite effective. And again, these numbers that we're talking about, no one was anticipating this, right? So to references, the FDA was said if a 50% efficacy came out positive, they would be happy. So the fact that the mRNA ones were talking about 95%, 100% for protection from hospitalizations for Johnson & Johnson, no one had any idea that it was going to be that effective. So these are all really good things, but no, it doesn't change your DNA. It doesn't rewrite your genes at all. All it is a quick little message on how to build a protein, and then your body's natural immunity fights that protein, and you should be ready to go if you get exposed to it again. I hope that helped answer some of your questions. The formaldehyde stuff, they don't use that. If you go on their website, actually, they're very transparent about what's in there. It's like fats and a little bit of solution, and that's what they use to kind of transport it in, and that's the mechanism that they're using.
Great explanation, Dr. Goldberg. Thank you so much. And Dana, we have just about 11 minutes left. We have a ton of people online still waiting to answer our questions. So we're going to do a fast and furious. Let's try to keep the answers a little concise. And please, your question, also try to keep it concise. We are heading to Mesa. Mesa, we have Joseph. Joseph, can you hear us?
Yes, I got a couple questions. What is taking so long to get the pharmacies? Because almost everybody has at least 4 or 5 pharmacies within a 2-mile radius, and that'd be the quickest way for people to get the vaccine. Another question is, how many places does East Mesa gives a vaccine? Because I'm looking for a place so my wife can take her second vaccine. It'll be after the 1st March. So how many places or where can a person get it?
That on me? I could say I don't know off the East Mesa one. I will say what the website that the ADHS website has a vaccine site where it shows all the locations of everywhere you can get a vaccine. So they should have the list for the East Mesa sites. I personally do not know. I apologize. As far as your first question about why is it taking so long, that's a common question. Like I talked before, logistics have been an issue, and they've been slowly ramping up about who gets what. There's been a big push to get the pharmacies more involved. They are set up through the CDC. So yes, there is a big push now that we are entering these larger groups of people that need vaccines. And now that we've figured out some of the logistics, what you don't want to do is start with something and just spread it everywhere. And it's kind of a mess that way. You can't figure out what's going on. You want to figure out the logistics behind it first. Now that we've kind of got some information under our belt, how to do this, what works, what doesn't, we have the ability to expand it. And that's why the pharmacies are being tapped now. The state's been pretty aggressive asking to activate that. You have to make sure the pharmacies are uploaded into the system and then able to get the vaccine. And again, you want to make sure you have the vaccine available. So as long as the supply is there, you'll get it distributed out. And that's the big thing that we've been waiting for. That has slowly been increasing as we've been going through this.
Thank you, Joseph, for the question.
More.
We are heading to Tucson. We have Margaret. Margaret, can you hear us?
Yes. I have a friend who is 53, immune compromised, bipolar mental health, terrible high anxiety. When will those type people be able to get in? And she's on Medicare, not Medicaid.
Again, hopefully soon. That is exactly kind of one of those patients we talked about that, probably needs to go higher in the list, but they have not determined exactly how we're going to figure out how to rank these pre-existing medical conditions yet. We're still in those phase 1B, kind of going to the 65 and older group now in the 1C. But yes, these are people that need to get access. I agree. Personally, I do not know when that's going to happen, hopefully soon. We're trying to figure that out now. I have family members that are immune compromised that are waiting as well. So I definitely understand that issue. And that is being discussed at the state level on how to go about doing it. It's just a matter of how many people we're talking about and how many vaccines we have available to make sure everyone can get covered.
Okay. Thank you.
Thank you, Margaret, for your question.
I don't know if Director Snyder had any more than that. I didn't mean to jump in there, but that's all I had.
No, I think you captured it perfectly, Dr. Goldberg.
Oh. I'm learning. Okay.
We are heading to Sierra Vista. And we have let's see, Agnes. Agnes, can you hear us? Hello, Agnes. We don't have Agnes. Okay, so we are going to move now to Tempe, and in Tempe we have Tom.
Yes.
Tom, can you hear us?
I can. Mm-hmm. My question is,
Go ahead.
Is this. My wife and I both have gotten our Moderna vaccine 1 and 2, so we've got that taken care of. But we're planning to do some traveling later in the summer, and they're talking about a passport that you should get that says you've been vaccinated. Where do I go for that? And do we have that yet in Arizona?
Would that be the actual vaccination card?
Yeah, the passport is supposed to say, let people know that we have been vaccinated.
And you didn't receive one when you got the passport?
I'm sorry, I missed that.
You're being asked if you received that card with the vaccination lot numbers and things like that. Did they give you one when you got your vaccine?
I do. We do have the card. Yes. Is that all?
I'm not aware of any of this right now. Yeah, as far as I know, that's all you need. There is no official passport. I know that was been discussed, but having it. What I do is, if you have a smartphone, take a picture of it and save it on your phone, so you don't have to walk around with the card. Because there's a chance you could lose it. Trust me, I've tried to lose it multiple times already, unintentionally. But having a picture kind of on the phone is a way of storing it to show. Hopefully, by the time we're talking in the summer when you're traveling, things will be a lot looser because everyone will be, or close to everyone will have gotten a shot by that point.
Thank you for the question. We are heading to Tucson again, and we have Cynthia. Cynthia, you are live. Can you hear us?
Yes, I can.
Go
Can you
ahead.
hear me?
Yes, we sure can.
Okay, I had one of the worst allergic reactions you can possibly have, Stevens-Johnson syndrome, and I'm worried about getting this vaccine. Can you talk to me about that?
So that is tricky. That is something you definitely want to talk to your physician about, especially now that we're talking about another vaccine that's going to be available soon, the Johnson & Johnson. So there's a lot of concern with allergic reactions. A very small percentage of the population were having allergic reactions. Was it, and again, I don't want to dive into your medical history on a town hall here. So I would talk to your physician, because depending on what caused the Stevens-Johnson may determine on what one vaccine you may want to get. I know some immunocompromised people who've had issues are better off getting the Moderna or the Pfizer, versus some are good at getting the Johnson & Johnson because of the mechanism of action. So talking to your primary care physician is very, very important to talk about your specific medical history and what may be the safest route for you to go, depending on what you've reacted to in the past. And then being aware, you may want to wait for other ones. So you want to go through your history, and it is a relevant and important question to ask. And I would really encourage talking to your doctor about it beforehand, because they're going to know all the nuances behind your history and be able to direct you down where the safest path for you to go is.
Wonderful. We have time for one last question. We're going to go to Prescott. And Prescott, we have Sherry.
Yes.
Go ahead, please.
I have gotten probably some of my answers from the people that have already spoken, but I can't find any place to get the COVID shot. I call, I wait. I was up for 4 hours the other morning, and it's just getting very frustrating. I live in Yavapai County, and we don't seem to have any up here at all right now. When should we expect them?
Distribution's been an issue. I know that there's been frustrations. The problem has been is that the state doesn't get to really know that far in advance what they're getting. And sometimes things like weather occur and mess up the delivery. So I know they're actively working on increasing the dosages to make sure that it gets distributed throughout the state. So hopefully shots are coming soon. I do apologize for your frustrations. I know it can be quite frustrating. We'll reach out to let them know that, again, to make sure that Yavapai and other these counties are getting these shots. It really all depends what they're getting from the federal government. That's the one of the rate limiting steps, unfortunately, because we're not producing the vaccine locally.
And I'll just add,
we're almost out of time.
Real quick, let me just add, if you go to AARP's website, aarp.org/AZ vaccine, we link to the Arizona Department of Health website to be able to get an appointment, as well as every single county, including Yavapai. So that should be a good resource for everybody. Again, that's aarp.org/AZ vaccine to be able to link to the Department of Health, as well as every county Department of Health that's available to you. So on behalf of AARP Arizona, I want to say thank you to everyone for taking part in today's Teletown Hall to discuss the coronavirus pandemic. We've been talking to Dr. Ross Goldberg, as well as Director Jami Snyder. Thank you for joining us today. As we near the end of our call, would either of you like to follow up on any other questions or share closing comments?
Well, I would just say thank you for inviting me to participate in today's conversation. As always, when I am part of a discussion with Dr. Goldberg, I learn along the way as well. So I just really appreciate this opportunity. And Dana, I'm happy to come back at any point in the future to talk further about our vaccine distribution efforts within the Medicaid program.
Thank you, Dr. Snyder.
Thank you again for having me. Again, it's always a pleasure. You guys asked some really, really good questions. Keep me on my toes, so I have to go read some more. So next time before I come back, I'll make sure I'm well prepared. These are great questions, and I appreciate the opportunity to speak to you guys.
I agree. We've got great members with a lot of great questions, and that's why we do these Teletown Halls, to be able to answer their questions, and we know other people learn from them as well. In the face of this crisis, we're providing information and resources to help older adults and those caring for them to protect themselves from the virus, prevent its spread to others while taking care of ourselves. For more information about the coronavirus in Arizona, you can go to aarp.org AZ vaccine or call 1-888-687-2277. Thank you for participating in the discussion on this important topic. We apologize if we were not able to get to your answer or question. You can also obtain valuable information through AARP publications on our website at aarp.org or by calling 1-888-687-2277. This concludes today's call. Thank you and goodbye.